From the RSNA, this is the Radiology Artificial Intelligence Podcast. My name is Paul Yi, and I'm a radiologist at the University of Maryland and co-host of the podcast.
And my name is Ali Tejani, and I'm a radiology resident at the University of Texas Southwestern Medical Center and co-host of the podcast. Each month, we dive into the hottest topics in radiology AI and talk with leading experts, thought leaders, and movers and shakers in the field.
Welcome back to the Radiology Artificial Intelligence Podcast. For this episode, we're joined by Dr. Florence Doo to talk about sustainability in radiology and AI. There's never been a better time to reflect on our impact as clinicians, researchers, vendors, and administrators on our carbon footprint.
Florence is Director of Innovation at the University of Maryland Medical Intelligent Imaging Center and Assistant Professor in the Abdominal Division at the Department of Radiology and Nuclear Medicine at University of Maryland, Baltimore. She completed her radiology residency at Mount Sinai West with dual fellowships in body imaging at Stanford University and imaging informatics at the American College of Radiology. Dr. Doo's expertise and publication record span body imaging, artificial intelligence, health equity, and entrepreneurship. She is also a recipient of the AUR General Electric Radiology Research Fellowship Grant to pursue research in radiology AI, cloud services, equitable health delivery, and environmental sustainability.
Welcome, everyone, to another episode of the Radiology Artificial Intelligence Podcast. It's our pleasure to have Dr. Florence Doo talking with us about sustainability and climate change and AI. So, Flo, let's start with, what is sustainability? You know, this is a term that's been thrown around a lot in the general public when we talk about global warming, climate change, but when we think about radiology, it's not necessarily top of mind. So what is sustainability and how does it apply to radiology and AI?
Great question, Paul. So I originally thought of this topic really because of AUR when I first went to that meeting last year. And it was a really eye-opening experience because we really thought about sustainability, not just in terms of climate change, but really beyond that in terms of economic, environmental, social sustainability, and climate change. And it really is, how do we keep our field sustainable in the future, just from across education, but also how do we practice sustainability such that we have radiology and our planet in the future, and we can kind of preserve what we have and make it better for future generations.
I'm actually really happy that we're talking about this in radiology now. It's been a long time coming, if you ask me. And so when you think about trying to recruit similar-minded or even others who may not have thought about this before, Flo, how do we convince them? We have tool developers, we have AI tool users in our audience. How can we convince them that they should be thinking about sustainability?
Surprisingly, I think in a lot of conversations I've had with people, I think it's one of those times where I felt old. I feel like it's one of those conversations that a lot of people who are in Gen Z, especially, it's top of mind for them, right? Because when we say climate change is happening, it's happening in an acute way and also in a long-term way that affects lives around the world. Currently, I'm sure all of us have experienced the heat waves and hurricanes and tornadoes and wildfires and things that have been top of mind and across the news. And I think there's no need to convince people of how pressing climate change may be in that way. But how radiology is relevant is a different question. And I think it's really exciting right now to see that it's becoming relevant in radiology. I think we're noticing that healthcare is a huge contributor to climate change and radiology itself, because we're so energy focused and technology focused that we cross sectors in a different way compared to other specialties. And we drive a lot of hospital conversations about how we spend money and earn money in a hospital system. So that financial sustainability piece is another thing that radiologists really contribute to. So there's a lot of places in the conversation, radiology and artificial intelligence, and how we see sustainability exist in the healthcare system, has that radiology lens to it, but there's so many places and ways we can all contribute across the healthcare system.
So Flo, thank you. I have a quick follow-up question there. Talking to admin or to C-suite, we want to bring this to the top of their priorities, to the top of the things to do next. Have you had experiences or talked to others about this? I say problem, maybe it's not so much a problem yet or will be, but how do you bring this to the top of that list, right? How do you bring this to the attention of people who make decisions in a department, at least at the local scale?
You're asking, I think, a very layered question in a very nice way. I like to kind of solve problems, right? And I think everyone likes to solve the problem that's in front of them and what is important to them. So I think right now, in terms of healthcare systems, it's hard to convince someone of your problem, but kind of addressing their problem in a way that's saying, hey, look, the solution to the things that you're thinking about, how do we recruit more staffing? How do we make the workplace safer for people? How do we recruit people to come to our institution? And how do we make ourselves the leaders in our field? I think there's lots of questions like that are brewing behind people's minds. And I think having something that kind of answers all those questions and touches on those, kind of reframing the thinking process to say, hey, look, what's the biggest question you can ask? What's the biggest thing that somebody can put their energy and time and resources towards that could improve patients' lives locally, in the community, and globally? How can we solve financial sustainability? How to recruit people? All these things are touched on by climate change, which I think is super fascinating. Once all the dots kind of connect and you kind of realize like the local becomes global in that way. And that's what's really exciting and thrilling is there are a lot of local leaders that have really thought of this originally as a very crunchy topic, right? Like it's those people over there that are always protesting, whatever, that are only care about climate change. But I think right now we're realizing this is, if you're not looking at it, right, it's just because you didn't have the words to capture that. And now that you do, you can tackle it. And I think a lot of leaders are currently thinking about it now in a good way. And I think we're just looking for solutions. I've noticed that RSNA has added a emerging topics area around sustainability, and I've seen a lot of great ideas come through there.
And speaking of great ideas, Flo, you were recently awarded the AUR GRAF Fellowship for a project about sustainability and climate change in radiology, and specifically in AI. So clearly, you're very successful in getting the attention of some of these folks at the top. So can you tell us about this project? What's it about? What are you studying during this fellowship?
Oh, yes. So I'm very fortunate to be working with a great team at UMI. It's the University of Maryland Medical Intelligent Imaging Center, and some great people at the School of Public Health, Dr. Amir Sapkota and Dr. Ruth Carlos as well at the University of Michigan. Also Dr. Jean Judy, who's the Vice Chair of Informatics at University of Maryland. And I'm naming these folks because part of GRAF, as you know, really involves a lot of mentorship, and it really promotes interdisciplinary thinking. And I think a topic like climate change really needs that interdisciplinary thinking. So one of the things that was really driving my thinking towards GRAF was, again, the big question, right? What do we want to know as radiologists? What do I want to know as a scientist? And I think we didn't have data on how radiology was contributing to climate change. We didn't have an idea on artificial intelligence contributing to climate change. And again, these are things that Microsoft or Google or Amazon, those big companies and small startups, are thinking about, but it didn't really cross bridges, I guess, for radiology. So I'm studying the carbon emissions of cloud computing, artificial intelligence, and computer vision, and also thinking about the health outcomes. Although that's a little bit farther down the line in that attribution science is not very well developed. But what contribution do we have as radiologists to the climate, and what kind of health impacts may result from having changing climate in the local or global scale? And one of those things is another grant that I'm going to be writing as well on health outcomes related to climate change. But that's currently what I'm hoping to be studying, and I've just started on that journey, so I have a lot to learn.
Yeah, so you mentioned some different terms like carbon footprint and carbon emissions. For those of us who aren't as well informed, what's the difference between a carbon footprint, a greenhouse gas emission, some other energy output terms? Are they all the same? Or are they synonymous?
The great question again. They're not synonymous. And actually, there's quite a lot of different, I think, as you astutely pointed out, carbon emissions versus just greenhouse gas emissions. We focus a lot because carbon emissions is very easy to understand. It's used a lot. But greenhouse gas kind of envelops a lot of the different gases that are produced by climate change. And actually, surprisingly, anesthesiology, for example, really contributes a different kind of gas to the thing. I won't go too far into that. But one of the important things to understand, I think, to drive this conversation is really the scopes of greenhouse gas emissions. One of them is the Greenhouse Gas Protocol, which is developed and describes kind of our emissions in different scopes. And those scopes are just something to consider because as we're thinking about how we're contributing to climate change, you have to say, is this something that I'm directly doing? Is my company or what I'm doing directly contributing to climate change in a one-to-one way? Or is it something indirect, either upstream or downstream, that is contributing to that? And also the energy that's secondarily like a scope 2 kind of thing coming back to drive that usage. So there's a lot of different terms there. There's not a lot of papers out there, though, surprisingly, describing this in a radiology context, which I'm really hoping to do more work on and collaborate with more people to write those papers. I think there's a lot there to kind of investigate and see, hey, once we understand these terms, once we understand and define what our different scopes are and these different emissions are, we can then better find ways to address them And even in defining them, I think there's a lot of controversy and ways to think about it and say, hey, look, this isn't this scope, but maybe it's this one. And it's because of that, right? We can do XYZ to handle that particular emission.
Yeah, so it sounds like when we think about these different terms and essentially our contribution to carbon emissions and maybe climate change, part of me wonders, has this been going on for a while? How long have we been contributing to this? And maybe the obvious answer is, well, ever since we've been living on planet Earth. But I wonder, have things from a contribution standpoint really ramped up in recent years, or has it been kind of a slow burn over the past, 100 years or so since we've been a profession?
I think I will leave that to a very dedicated climate scientist to get into the weeds on how long it's been. But I think what you're touching on here is that climate change, interestingly, is an accounting problem now. On a global scale, how we measure it and who measures it ends up changing the conversation drastically. And I think that's why I want us as individuals and scientists and also radiology as a field to consider how we measure it and how we contribute to that global conversation. What do I mean by that is if you say that you're contributing something X, right, as a direct emission, at like, for example, your AI tool, and you're not attributing that to someone else, like a vendor's direct contribution, how does that change what you do with that? And also, how do you do that measurement on a day-to-day basis, month-to-month basis, yearly basis? Can you say you spend more during the summer and you spend less in the winter, or maybe more at 12 p.m. but less at 2 a.m.? And that accounting is very different across systems. And so overall, there's a lot to do in that conversation. So I don't know how long we've been contributing to it, but I do think the measurements that we're developing are becoming more sophisticated, and we're having more sophisticated conversations around who's doing that measurement and how we measure.
Thanks for joining us for this episode. We hope you enjoyed the conversation just as much as we did. Stay tuned for part 2 of our conversation with Dr. Doo.
Subscribe to the Radiology Artificial Intelligence podcast for more discussion on content from the journal and hot topics in our field. Thanks again to all our panelists involved in the conversation.
We hope that you've enjoyed this episode of the Radiology Artificial Intelligence podcast. Shout out to Uriah Shemchison for our podcast music and to the RSNA podcast staff.
Email us at podcast@rsna.org anytime with questions, feedback, or suggestions.